So what if you've been turned down for LASIK or for any kind of laser vision correction? Many patients will get really upset, but it's important to understand why you have not been offered laser vision correction. How laser vision correction works is we are trying to change the shape of the cornea. Essentially, right now, the cornea is steeper than it needs to be, so we need to flatten it a little bit. How we flatten it is by removing some tissue from it. So different lasers remove tissue in different manners, but they all basically have the same principle. So if, let's say, your cornea is too thin, or if the shape of the cornea is such that we feel it might be weak, and if we weaken it further, we might not have stability or we might have other problems in the future, then we prefer to avoid laser-based procedures. Even if, let's say, you have very severe dry eye or some other issues on the surface of your eye, or if you have a very high number, because in order to correct a very high number, we would have to remove a lot of tissue. Then in those cases, we do not consider laser vision correction to be a safe option. So for patients in such situations, we have an excellent option, which would be ICL, where we implant a very thin lens, which looks something like a contact lens, and we implant this inside the eye. It simply sits on top of your own natural lens. And it's a completely safe and actually completely reversible procedure, because we do not remove anything from the eye in order to implant this lens. We do not change anything inside the eye. We gently just place it in there. So if at any point, if you want, we can completely remove it. This is a procedure that again does not impact the health of your eye in the future. If with old age you need to undergo any other kind of surgery, any other procedure for any treatment for any disease, you can very safely do so. So there are no long-term consequences in that sense. So it is a very good option for those patients who have been refused any kind of laser vision correction. The only necessity that we have in order to be able to implant this lens is that where this lens sits, we need enough space so that we can make sure that the lens has enough room where it is not disturbing or touching in other important structure of the eye. So that is called the anterior chamber depth. So we do certain tests which help us measure that. And as long as that is adequate, we can very easily implant this lens, even if you are not suitable for laser vision correction. So the best part about the ICL is the wide range of numbers that we can correct. Sometimes patient will walk in with a number of -6, -7, and they'll feel that it's a very large number. But with ICL, we can actually correct all the way up to -18 diopters of number, along with 6 diopters of astigmatism, which is a cylindrical power. Even if you have a plus number, up to +10 can be corrected with the ICL. So it is a very good option, even if you feel that you have a very large number and you're worried that, oh, nothing can be done. That is not true. There is a very good option available for those with higher numbers also.